Hello, everyone, and welcome to this audio podcast. This audio podcast is part of the Pathogenesis edition. This audio podcast is part of the Torpedo storm. This audio podcast is part of Storm Richter. This audio podcast as part of a Storm Robotics production. And this audio podcast will highlight we'll highlight some aims and objectives. So the authors in the peer review works from 2018 present data sought to present data from the UKRR to explore and to also explore how service evaluation and pediatric health practices and services can be enhanced through a better understanding of clinical of specific or particular clinical care networks. At the same time, the authors sought to highlight some bases from some bases in around social media social media platforms such as the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, KDARS group for kids, where service providers and service users um, have opportunities to share experiences and discussions about the participation aspects participation in healthcare. At the same time, the original works from 2018 also was where the authors in around this works had highlighted that as part of the sort of aims and objectives to highlight or the sort of the premise or the basis was also to highlight that adequate staffing and in context of particular areas of specialty sort of training in around clinical practices are and have been an ongoing issue, along with inadequate investment or cuts to services and increasing pressures on staff time. And so, with all these issues, there should be the authors highlight that there should be a sort of an evaluation which puts patient care at the heart of healthcare that puts patient care at the heart of healthcare services. So that draws this audio podcast to a close. This has been an audio podcast as part of a Pathogenesis edition, an audio podcast as part of the Torpedo storm, an audio podcast as part of the Storm Richter, and audio podcast as part of a Storm Robotics production.